Welcome. South Africa has administered over 18 million vaccines. Over 9 million people are fully vaccinated, and they can now apply for a COVID-19 digital certificate through a digital vaccination certificate portal. Health Minister Dr. Joe Phaahla joins us in studio for more updates. Thanks so much for your time, Doctor. We appreciate it.
Thank you.
Keeping you on your toes on a Saturday afternoon.
Well, thanks for the opportunity.
Sure.
Yes.
Let's just start off with this vaccine certificate that's just launched. Many people on social media are experiencing some frustration, saying their vaccination code has not been picked up. Tell us how the first official day since it launched yesterday has been going.
Well, the uptake has been quite good. The report I got yesterday was that already by 10 o'clock, more than 300,000 certificates have already been downloaded. I didn't get the feedback by, say, close of business, but just also being on various social media, I could see that there were people who experienced some hiccups, but there were many also who said in a minute they managed to access their vaccine certificates. So I'm sure, you know, like anything, when it starts, there will be some hiccups, but I'm sure the team, our team working with the CSIR team, will be able to sort out those hiccups. Some of those, I was told, it might be also situation where maybe when there was no network, sometime the team would have taken the details on paper. Maybe, you know, by the time they captured, you know, the information was not properly captured. But, you know, with the call center also available, all those hiccups will be addressed. And I'm sure as we move forward, it will get better and better.
Sure. I mean, I downloaded mine in less than a minute. It was very quick. This leads to my next question. Many are saying that this is possibly a move by government to eventually make vaccines mandatory, or make it mandatory to have a vaccine certificate to go into certain spaces, entertainment, sports events. Is government having a conversation about making vaccines mandatory?
Not at this stage. I think
after elections.
No. It's got nothing to do with elections. Our approach, if you remember, right from the beginning of starting the vaccination rollout, the President and Cabinet have made it very clear that it's voluntary. We have to make sure that people are persuaded and convinced about the safety and also about the protection that the vaccines offer. Now, clearly, there's a lot of debate about the public health imperatives, because this is not just about personal health, it's also public health, because if you're not vaccinated, you know, when you do get the virus, the evidence is that you transmit more viruses, you carry more viral load, and therefore the possibility of infecting others is much higher. So there is also a public health issue around it. But we are very cautious in terms of going that route. That's why what we have said is that rather than the clamor, many people are pushing to say, legally, you're on firm ground, nothing against the Constitution, because it's about public health. You know, there's individual rights, but individual rights are also trumped by public rights.
Sure.
So, but our approach so far is to say that from a state and a government point of view, we should concentrate on getting the message across. But in terms of private institutions, institutions which have their own rules, whether it be private business, whether it be, you know, independent institutions like universities and so on, all the time, and even industry, they have their own policies as long as they are within the constitution of the country. So we will not interfere with individual organizations making their own policy in line with, you know, public health, but also in line with the Constitution of the Republic.
Does hesitancy keep you up at night? Because the reason I ask this, many people have expressed dissatisfaction with governments not being able to produce sufficient data as to how effective these vaccines are, and many saying that somebody just got vaccinated and they passed away because of the vaccine. Does hesitancy worry you? And does the fact that there is no sufficient data as yet to say certain amounts of people were vaccinated and the unvaccinated were in fact the ones that ended up in ICU and on ventilators? Well,
I would agree that in terms of absolute studies, in terms of professionally recorded, peer-reviewed research, your proper research at this stage, simply because, remember, vaccines have essentially been available when maybe from in the north, in Europe and the US, maybe as early as December, but mostly from January. So we're talking about, a program which is barely 10 months old. So, I mean, for any proper research, you would need sufficient time, sufficient volume, and which the vaccination program. But we do have various, even if it's not fully researched information, we've got data from various hospitals in South Africa. We have data from, for instance, in our case, in terms of the categories where we started, the health workers. We are now working on getting those to be properly studied. And the Medical Research Council will be helping us in terms of that. But we know that even if you don't have proper studies, but we know for a fact that if you look at the first wave, look at the second wave, and you look at the third wave, which you have just exited, very few health workers have actually been fallen sick from COVID. Even with the teachers who we vaccinated as the second group, very few teachers have fallen sick in the third wave. And if you look at also reports from countries which started early, the similar pattern, it does indicate. But clearly, within the next few months, we will have properly researched and documented information in that regard.
Sure. Minister, you are a doctor. What do you say to anti-vaxxers? What do you say to people that still believe this is not a pandemic, that still say this is all fake, there's nothing true about this, the vaccine is dangerous? Also linked to that, looking at what the third wave did to our country.
Well, it's unfortunate, and we are grateful to the many South Africans who, notwithstanding the bombardment, on social media, scary stories, videos, and so on, the fact that we just short of almost approaching 13.5 million South Africans. You mentioned the figure of the fully vaccinated, but just those who have already taken the jab, and many of them are coming back for their second doses on the Pfizer. We just short of 14 million South Africans. So that says to us that notwithstanding the bombardment with all that information, many South Africans actually, accept the information that indeed they've seen. I think at this stage, I doubt if there's any South African who can claim that they don't know any friend, relative, neighbor who has actually died from COVID-19 over the last 20 months or so. Now, clearly people, anybody who still has doubt that, who says COVID-19 doesn't exist, must be living in another planet. Secondly, in terms of the fact that, look, we accept the fact that the vaccines are only, as I said, just about 10 months old, in the world. So the doubt would be there. But in the absence of any other available proven remedy, the fact that these are remedies, the vaccines have been tested by established regulators, but also thanks to those who, even when there wasn't enough data except for the studied trials and the trials of the vaccines, thanks to those who came forward, especially our health workers in South Africa early in February and March. Now, we now have practical information which shows that these vaccines are working. We can quote particular cohorts of South Africans who can stand up and show that this is what happened before, this is the before, and this is the after. Yeah. So we are grateful for that. So we are saying to those who are still doubtful, we do accept that this is a new science. You know, some people will take longer to convince, but please, all that you can appeal is keep it to yourself. Don't try and influence others negatively, because on the other hand, there is ample proof that these vaccines have worked. There are many people who have been, because of the fact that who have comorbidities. You would remember in one of our morning presentations, we had one of your colleagues in the media, Ms. Karen Mon,
yes,
who came forward and who could show that people, being diabetic, other people she knew who were also being diabetic, who got the infection before they could get the vaccine, had a much more severe, and some of them passed away, and she had just a mild, and she was able to do very well. So there are a lot of living, testimonies in terms of the efficacy and safety of the vaccines. So we appeal to those really, just to open their eyes and look at the facts.
Sure. Before we get into the SIU findings, I need to ask you, do you think government failed in getting vaccines to people quick enough?
Look, you can never really claim perfection. As they say, hindsight is a perfect science, There are a lot of things which we could have done better, but also there were just too many risks. We are not a well-endowed economy as a country. We couldn't compete with, countries in the north who could put millions of dollars and pounds into companies when they were actually in the research mode of researching the vaccines. Those countries put millions. We struggle just to maintain our health facilities, to make sure that people don't sleep hungry, that, we can feed our population. Now, as I said, hindsight is a perfect science, because you can imagine if we could have put R500,000 into Company B, which was doing research on vaccines, and they failed, what kind of criticism would have been there? Of course, people assume that we could have anticipated that Pfizer would have been successful. So why didn't you pay upfront?
Sure. Yeah.
But those are things. But so I would not deny criticism by those who examine the performance of government. We accept the criticism, but the fact of the matter is, having accepted that criticism, we moved with speed in terms of immediately, now that once it was tested that these things can work, available, moved in, made sure that we negotiate to get the contracts, and a few months from the first disappointment with the AstraZeneca, with the Beta variant, we moved in quickly and clinched some agreements. And today, we are talking in a situation where, compared to many countries, I'm not saying necessarily that we should only compare ourselves with the middle and poor countries only, but compared to many, not just in the continent, but in various parts of the world, the fact that we have adequate vaccines, we have adequate capacity, it's an envy to many countries. And that's why we say to South Africans, please come forward. This is an opportunity of a lifetime.
Sure. Minister, speak to us about the SIU findings. We understand that 7 health officials have been placed on precautionary suspension. What is the status of these 7 officials? Have you started with disciplinary processes? What's the latest on that?
Well, what has happened now is that the acting DG has appointed investigators, because the way the process works, you first have to appoint a team of investigators. You've got the SIU report. It does state for each individual what they are alleged to have transgressed. But you still have to have a formal investigator who's then going to determine whether there is a winnable case in a disciplinary hearing. And there's enough information to put a case in front of the individual. So they're busy with that. I think from what he said to me a day ago, in the next week they should be able to report on that. And then once they've concluded on that, then we also then appoint a chairperson of a hearing. So our hope is that before the end of this month, before the end of October, if not concluded, all the hearings, where first of all they must tell us, yes, in the case of so-and-so, there is a case to be answered. And then we appoint a chairperson of a hearing, and then the date is set, they're given the charges, they have time to go and prepare, and then once they're prepared, then the date is set. So we're hoping all that, at least by the end of October, if not concluded, we will be far, so that we don't go too much into November without conclusion.
So by the end of October, disciplinary processes will have begun?
They would have begun, definitely.
Against the 7 officials?
Against the 7, because, yeah, all that is left now is their case, yes. What is the case? They prepare charge sheet, present it to the individual. They have their own representatives, advisors, legally to advise them, prepare a case, agree on a date. So my instructions to the acting DG is that we can reach the end of October, if not concluded, but at least in the middle of hearings for all the 7.
Sure, I'm sure a lot of South Africans will be pleased to hear that, because we do know that these 7 officials have been placed on precautionary suspension with pay. You mentioned earlier on that we aren't an advanced economy like others that could have just put millions down. But the SIU findings indicates that 150 million rand was taken out of the Department of Health, and they are trying to recoup that money. How are you going to rebuild trust with South Africans at such a crucial time in this pandemic, with a 4th wave expected in December? Many people are just saying that it's been truly unfair how all of this has played out. When people were dying and needed ventilators, 150 million rand was wasted. Speak to us about what your plan is to rebuild this trust.
Well, I must admit that, I mean, this was, what happened, really highly regrettable. It's what you don't need in a situation where a key to success is a trust of government by the population, and especially a leading department, which has to also, I mean, if you remember, during the course of last year, when the president declared that there must be stimulus packages, reallocation of budgets, a lot of various functions had to forfeit some of their funds in order to support the economic stimulation, people who who have lost jobs, but also on top of that, health also had to be topped up, so that we could buy the things you're talking about: oxygen, ventilators, additional hospital beds, and so on. Now, something like this, which now just says that, the very same department which is leading, which must be topped up with additional resources, actually goes and wastes those public resources, is the last thing you need in that situation. So I do admit that this has put us backwards in terms of the trust of the public. So in terms of how we're going about it, firstly is making sure that there's action, as I've indicated. We're thankful to the work which has been done by the SIU and the fact that they've now given the report, and we're acting speedily. As soon as we got the full report, we immediately moved in, and that's why we don't want to waste a lot of time. That's why I've given the instruction that we must make sure that, if not concluded, those who are found to have enough information to actually present a case, those cases must start. But over and above that, the rest of other activities it's really just to make sure that we act transparently in terms of the programs, we communicate whatever information we have, but also we believe that slowly, as people see that indeed we are very prudent in terms of how we utilize public resources, we're not going to regain that confidence in a few weeks and months' time. It's going to be a process, but we're doing our best in terms of making sure also that when we say that this is what we're going to provide, we must, as best as possible, make sure that it is like that. So we're slowly just rebuilding that confidence through our actions. Sure. We hope through those actions, in due course, people will come to trust us again.
Hopefully, Minister. Thank you so much for your time. I wish we had more time, but okay. Thank you for all of that information.
Thank you. Thanks for the invitation. Thank you.
Sure. Thank you so much. And we wish you all the best. You have a target of 40 million by December. You still have 13 million to go, so good luck with that.